Have been 5 outbreaks of measles in the U.S. this year, despite the fact health officials declared this disease eliminated in 2000. Dr. Jamie Friedman is here with what you need to know. Doctor, good morning, and thank you for being here.
Good morning.
I feel like measles, we just don't talk about it a lot because it's just not an issue to parents. Like it's under control. Is it? What is measles?
Well, measles is a viral infection, and you're right. We hadn't talked about it for a long time because it had pretty much gone away. And now that it's making its comeback, I think parents need to be aware of what to look for.
When you say it's making its comeback, is this a big deal, 5 outbreaks of measles in the U.S.?
I think it's a big deal. Measles is very dangerous and it's extremely contagious, so it can spread pretty rapidly.
When you talk about some of the symptoms, what are parents looking for? Because some of these look like they're very similar to just a cold.
Right. Like anything else, the symptoms really overlap at first, but then it can change pretty quickly. So initially you're going to have the runny nose, the red eyes, the cough, the fever. The rash will come a few days later, and it starts usually around the head and then spreads down the body. And that's when the fever will spike. So the temp will go up to 104, the body will be covered in a rash. It's going to feel and look really awful.
So you're going to see it. If your child has the measles, you're going to know.
Yes.
At the point that the rash comes out.
Yeah, definitely. But sometimes you get sore throat and spots in the mouth. I mean, there can be very specific symptoms before the rash. The red eyes, the spots in the mouth, the runny nose, the fever. That should make someone very suspicious.
Why are we seeing this back? Well, we didn't talk about this for many years.
Well, the vaccine, which has been around for a long time, is very effective. Back in the late 80s, early 90s, they added a second dose to the series. And since then, it's really just decreased because it's so effective. Now we have pockets of communities that are under-vaccinated or not vaccinated, and they bring the measles into the community, especially if they travel out of the country where there's a lot more measles than what we have in the United States.
Is that what you're saying could possibly be bringing this back, is just people are not getting vaccinated for the measles, they're getting it, they bring it back, and it's spreading like that?
Yes. I mean, there's no reason to believe that all of a sudden the vaccine isn't working. It's the unvaccinated people that are getting the measles.
Okay, so if there's a parent who's watching right now and they're obviously concerned about their child's health, what is the takeaway? What is the advice for them?
The best thing is to make sure their immunizations are up to date and also talk to the doctor if they have any concerns.
All right, Dr. Friedman, we appreciate you being here. Really good information. You'll just check in with your doctor to make sure you're up to date on all of that.